Good morning, everybody. Thanks for coming in. And it's really a pleasure and a privilege to introduce my good colleague and friend, Dr. Laura Crotty Alexander. Dr. Crotty Alexander received her medical degree from Duke University and then completed her residency in internal medicine at Mass General Hospital, a pulmonary critical care fellowship at Harvard Medical School, and then a research fellowship in pediatric infectious diseases at the University of California at San Diego, UCSD, where she is now an associate professor of medicine and also serves as section chief of pulmonary critical care at the VA and associate chief of the larger division of pulmonary critical care and sleep medicine. Dr. Crotty Alexander's research is funded by the NIH, the VA, and the California Tobacco-Related Disease Research Program. She's published extensively on the effects of e-cigarettes, both basic translational clinical research, and more broadly on airway inflammation and asthma. It's a pleasure to have her here.
Good morning, everybody. It's nice to be here. Thank you for inviting me. E-cigarettes are my favorite topic, so yay! I'm gonna try and take you through some of the fun stuff about them and what we know. I also love questions, so do feel free to raise hands, put questions in the chat. Get started. There we go. As Juan mentioned, I have that grant funding, and so I have been instructed to say the views presented here are my own as a private citizen and not those of our government. I always like to take a step back and talk about tobacco, and also with this picture, you can see that the tobacco plant is really pretty, actually. So beautiful green leaves, and I spent 10 years in Durham, North Carolina, that is tobacco country. And so every fall, they would be drying the leaves, and so the whole city would be permeated with this sort of sweet, calming smell. But as we know, like once you light it on fire and then breathe in the smoke, bad things happen. And today we still have 8 million deaths worldwide from tobacco use. And to the point here is that 90% of tobacco users initiate use before the age of 18. So that's what I want you to think of, have in your mind. So on to our e-cigarettes, which are a tobacco product. So when people say tobacco, that does fall in the umbrella. So if you ask somebody if they use tobacco, technically they should say yes if they're a vapor. But if you actually talk to e-cigarette vapors, a lot of them don't consider it tobacco. And so it can be a few questions down the line to get that information. One of the difficulties in studying e-cigarettes has been their rapid evolution. So in 2003, the modern version was invented in China and came on the market in 2007. They looked a lot like cigarettes, if you see that top panel. Within a few years, they had evolved into vape pens that look very different from cigarettes. And then within a couple of years, they added in the third generation, which were really big, heavier devices that could be modified. And then now we're in the fourth generation, or the pod-based devices. So these came onto the market in around 2017, and they have dominated since. So this actually has been sort of 8 years where they've stayed about the same, which has been like really helpful for us because I haven't had to dramatically change my mouse and cell models. And the big difference between the fourth generation and all the others is that they have about 10 times the amount of nicotine compared to the earlier generations. So a lot of the data that was published for the first 3 generations doesn't really apply to the fourth generation users. So anytime I read a study, it's sort of like how applicable is this to our e-cigarette users? But now, since the fourth generation has been around for several years, we're getting data that I do think is relevant. So this is just another picture showing the evolution. And then on the far right are some of the examples of e-cigarettes today, or vape devices. Of course, you might come across something like this in your line of work. The Minions, who doesn't love a Minion? And then this one I thought was really fun as well, if you're gonna vape. But as we were writing a recent editorial, and I've thought about vaping as the use of an e-cigarette or a vape device. But more broadly in the population, if you use a vaporizer, that's also called vaping. even though the process is very different in my mind, but truthfully, like it is a substance that is heated and turned into something that can be inhaled. So vaporizers are also considered vaping. They tend to be used for cannabis products. This has been a lot of education for me. It's helpful that I have high schoolers and college students in my lab because they're correcting me all the time about my terminology. And so I'll send them out to like do research, you know, so that they can come back and be like, I found out this, instead of just using, you know, their knowledge that they already have. Dabbing is a particular type of, similar to vaping, but different, where you have a dab rig and a concentrated cannabis substance, and you use a heat source to heat this nail, and then add the concentrate, which then it turns it into a mixture of gas and liquid particles that can be inhaled. I point this out because this is a much higher heat system. And so when you apply higher temperatures, we see more toxins in the actual aerosols. So we consider this to be like, you know, a higher risk thing to do for your lungs. But dripping has the highest risk because you actually take a heated metal surface like a coil and you drop the liquid on it, and it immediately turns into a mixture of smoke and aerosols to be inhaled. And so this is thought to be like the highest temperature semi-combustion state. So with that in mind, like what is in these? Like when we think about our e-cigarettes, when we have somebody in the ICU who has E-Valley, and it's like, what was in that cloud that they inhaled? So not only are there chemicals that were specifically added on purpose, and we'll talk about those on the next slide, but all of these products, as I've shown these pictures, they have metal coils, they have plastic pieces, they have, you know, all these other parts. And when you apply heat to that system, that leaches into the liquids as well. And so it gets into the aerosol that you're inhaling. So people are inhaling sort of microplastics and metals along with the liquids. So to the liquids, there's like the three bigs, vegetable glycerin, propylene glycol, and nicotine, and then the flavors. So PG, VG are the vehicles. You can dissolve almost anything in them. Propylene glycol we use in the lab all the time because it's so good at dissolving stuff. And that's why it was picked for e-cigarettes, because nicotine can go into it really well. But the flavors are where most of our problems lie in terms of studying it. So there's thousands of flavors. You can mix them up, and it's like impossible to study all of them. And I'm going to show you some data about how the flavors can really change the health effects. And this is just a reminder that our mass spec friends who have studied the aerosols have found all kinds of things in them, but it really depends on which device and which e-liquid as to what exactly is in the inhalant. This is an e-cigarette I came across that I thought was interesting because you can adjust the quote ice level on the top, and then you can adjust the nicotine level as well. So you could sort of like, you know, change it just for your own inhalant. And this is just an example of, you know, how it's just difficult to know what people are inhaling. This is a do-it-yourself mix and match flavors, which I had never seen before. So on the far right, you can use like just the grape flavor. What is it? Blueberry? I can't even read it from here. Or you can combine it with cherry or with the mint. And so you can do your own like multitude of combinations, which again, like as a researcher, like it's impossible to study all of these. But we try, so live to try. So when Juul was super popular, was dominating the market, the top 4 flavors were tobacco, menthol, mint, and mango. So we actually did an experiment and exposed mice daily to these aerosols for a month, harvested the lungs, took the RNA, did transcriptomics. And you'll see right off the bat, if you look at the left, the mint and the mango like did not cause very many gene expression changes in the lung, which was kind of reassuring. But then if you look down at menthol and tobacco, they had like a really significant signature of like hundreds of genes. And they had a significant overlap as well with a shared like 1,400 genes that they were altering, even though we know from mass spec studies that they have no chemicals in common in the flavors. So it sort of comes down to, is that the real signal of the underlying components of the e-cigarettes, so the propylene glycol, glycerin, and nicotine? And then the mint and mango flavors actually sort of suppress those changes. So we're trying to work that out. But when we look specifically at immune pathways, again, the tobacco and menthol are the far left two columns, and they, again, were parallel. And they predominantly showed a down regulation across immune pathways. So that's what the purple and pinks are. Whereas on the right, the mint and mango had a sort of gentle increase in the inflammatory and immune pathways. So this is just one of the takeaways that, if somebody is vaping one thing, that might make them more susceptible. Like for the tobacco menthol, this signal suggests that they're going to be more susceptible to infectious diseases because they're not going to mount the normal immune response. Whereas the mango and mint, people might be more susceptible to inflammatory lung disease because they have that subtle increase in the responses. So that's why I think it's going to be very hard to see a signal in the community because each person's inhalant pattern tends to be different. And most people use more than one flavor. So it's going to be very muddy to see the health signals due to flavors. In general, since I'm an innate immunologist, so I always like to talk about the effects on the innate immune system because the macrophages and neutrophils are awesome. And so we've studied those for like over 10 years, like again, primarily focusing on what the vehicle components and the nicotine are doing to these cells. And in general, we see a suppression in functionality, so their ability to kill bacteria, phagocytose bacteria. Neutrophils are a little bit trickier, but they change so rapidly. So when they're in your bloodstream and you take them out of the body, like anything you do like activates them. And so it can be difficult to really see what the signal is, but we've seen that they tend to be more activated than usual, which we associate with, again, sort of autoimmune, pro-inflammatory conditions. But we also saw that they were not recruited to sites of infection. So when we did one of our first mouse models, we didn't infect in the lungs because I didn't want the chemicals to directly impact the bacteria or the cells. So we actually exposed the mice, but then infected them intraperitoneally. And the e-cigarette vaped mice didn't have a good recruitment of neutrophils to the site of infection. And so they had higher numbers of bacteria in it. So that was an ominous signal. Less has been done on dendritic cells and NK cells, but the studies that have been done have found alterations in their cell function. And then we're in the very early days of other cells, such as eosinophils, T cells, and B cells. But hopefully we'll be getting new data out there. For eosinophils, we actually took eosinophils from the blood. I'm like hyperallergic, so I'm a great person for them to draw blood on to isolate eosinophils. So they'll call me in when they have like a really big experiment to run. And so we vape media and then expose them to vaped media from different combinations of chemicals. And when we did transcriptomics on these eosinophils, and this was done by Praveen Akutoda and Nick Hogan, one of our fourth-year fellows, I want you to focus on the three columns to the right because the eosinophils are a little bit like neutrophils. They get cranky, you touch them, and they start changing. So even the buffer had some gene changes. But if you then look at Eve on the far right, that's the e-cigarette vaped extract with nicotine. So that's like what people are really inhaling. And so that top right corner is a set of genes that we believe are fundamentally altered by the nicotine in the vape, including some powerful signals from Siglec-6 and Siglec-15. Right below that, and you see the match in the blue box between the vehicles, that's the e-cigarette vape without nicotine compared to the e-cigarette vape with nicotine. So we think that those gene expression changes, the HMOX1, IL-32, IL-34, are driven by the propylene glycol, glycerin, and other components in the aerosol. And then right below that, you see a blue area, and that these are genes downregulated by nicotine. So I just put that up to just show that these immune cells, when they interact with these chemicals, like it changes them. And when you vape, about 95, 98% of the chemicals immediately go into your bloodstream. So they are absorbed like ultra rapidly. And any cells in your bloodstream are going to interact with them one-on-one. The final point here is that we saw more genes altered in the setting of nicotine with the vehicle than we saw between the vehicle and buffer, saying that the complexity is such that if you have these 5 chemicals, they can be doing one thing, but then if you add in like 3 more, it might shift it to do something completely different. So that's fun. Trying to sort that out. Okay, so patterns of use, stepping back to our kids and our adolescents and our adults. So all of us have been super excited about the decreased consumption of combustibles. So on the left-hand side is that beautiful trend down of from the Youth Tobacco Survey of kids using cigarettes. So starting at 16% in 2011 and dropping down to 6% in 2019. It's even lower today. But at the same time, we just saw that it was being replaced with e-cigarettes on the right-hand side, 1 for 1, and then actually it took off and sort of became worse than what it had been in 2011. We sort of saw this peak around 2018 to 2020 when 18 to 29-year-olds, our young adults, like, 85% of them had vaped in the past. So beautiful decrease in smoking, decrease in cigarette smoking over time on the left. And then on the right, this is the state of the union, so to speak, in terms of tobacco use. And you'll see that only 8% of high school and middle school students are using a form of tobacco, and that the vast majority of that is the second line down is the e-cigarette vapors. The nicotine pouches are rising rapidly, so they're at 1.8%. So this is an area that needs some study, and I'm actually like almost relieved because these pouches, like, it's really primarily nicotine. So for a researcher, it's like, I could do that, like just give nicotine and like see, what happens without like all of these amazing number of flavors. But we'll see. When we looked at gender differences and patterns of use, girls and boys really use most of these tobacco products to the same degree, with the exception of those in the red boxes, the nicotine pouches and the smokeless tobacco. So those are dominated by the boys in the far right column. I love to put in like the sneaky e-cigarette versions. The Sharpie is one of my favorites, where they literally like took a Juul e-cigarette and just popped it into the empty Sharpie container. And then of course the inhaler that's not a regular inhaler at all, but is a vape. But as I mentioned just briefly, most people are not just using one thing. Most people are dual or triple users. And when I say that, I mean that they're using combustible tobacco and nicotine vapes. They're using combustible cannabis and combustible tobacco, or they're using vaped THC with combustible tobacco and nicotine vapes. So we're seeing like lots of combinations. And this is a summary done by Ajit Singh, who showed that across these studies, everybody's seeing the same thing, where there's a lot of dual and triple use. And when we've looked ourselves at what's going on and what's the impact of combining these, we had a high schooler join our lab, and her question was, is vaping of cannabis, does it have the same effect as smoking cannabis in terms of the couch potato phenomenon and causing munchies? And I was like, okay, let's do this. We looked through the literature and we could not find data to support that the munchies were a real thing. So at least on the research world, there's nothing done to confirm that. But we designed a survey that had diet questions, exercise questions, and then our inhalant questions. And I'm glad we did a breakdown of the diet, because this signal came out that on the far right are dual users of any form of cannabis and any form of nicotine, and that they had higher intake of sugary drinks and of sweets compared to sole users of nicotine, sole users of cannabis, or controls. And so this was surprising, and we're working on a follow-up study now, but it raises the concern for metabolic syndrome. So if we're talking about teenagers who are doing this, and if it is driving their intake of sweets, then, could that long-term mean that they're at risk for metabolic syndrome? On the flip side, what we want to sort of look into is whether it could be the opposite, that people who like sweets, including drinks and sweets, like the sweets in vapes, because there's a lot of sweet flavored vapes. So have to sort of tease that out before we know for sure. This study came out in tobacco prevention and cessation recently, and in college kids. And you'll see that actually the number one sort of drug of use was alcohol. So that's the largest circle, but that almost all of them were also using tobacco in the top blue. To the right is a cannabis circle and cream. And then in the middle is the illicit drug use. And that you see lots of overlap of those things. But their main question was whether vaping impacted mental health, which is a question that we've really been interested in ourselves because we know that combustible tobacco is associated with anxiety, depression, as drivers and can cause it, but we haven't proven that in the e-cigarette world. And so in this one, when they looked at just people who are only vapors of e-cigarettes, that's on the first column, they had a 1.63 greater odds of having had a mental health diagnosis or begun treatment for a mental health diagnosis in the prior 12 months. And that was a stronger association than people who used multiple things, including e-cigarettes, which is a 1.47 odds ratio, versus the people who were multi-users but did not include e-cigarettes at 1.13. So I just pointed this out because this was a newer study, but that's sort of similar to what other people are seeing over the years. This college student, Annie Banjo, came into the lab, and her specific question was, why are these young people who are vaping like bubblegum vapes or, ice blueberry, like why in the world would they switch to combustible tobacco? Or why would they add that in? Like, it just seems so weird from outside of that frame of mind. So we designed this survey to try and tease out like why young people were switching. And so on the top are vapors who switched to smoking. And then on the bottom are smokers who switched to vaping. In the upper panel, you'll see that the number one reported reason was that smoking cigarettes is healthier than vaping nicotine. I mean, people call me an e-cigarette hater, but I wouldn't even agree with that. So I just feel like there's a real opportunity in advocacy and policy to try and like help change the conversation and really get the word out about like smoking tobacco is terrible. Like, you really shouldn't do it. And then down below, the smokers who switched to vaping, the second reason was vaping nicotine is healthier than smoking cigarettes. So again, we have people who have these beliefs, and this has actually been true because I usually ask, like the first 5 years I was doing this, I would ask the audience, like, which is worse? And it was like a third who said smoking was worse, a third said vaping was worse, and a third thought that they were equally bad. So again, messaging. And then in terms of like why people are dual and triple using, the top reason reported was to increase enjoyment, followed by to have more variety, or because people around them were vaping and smoking. So why have I been so focused on like trying to block initiation? It's because like we have like really good studies, like 2 massive meta-analyses that confirm that if you are an adolescent and you vape nicotine, you have a 4-fold higher odds of taking up combustible cigarette smoking. And so that's why it's important to be really aggressive with our adolescents to try and prevent them from starting in the first place. Beyond that, the other question that I often get are like, what are the real harms of, vaping? And of course, it's always difficult because, we've only been studying these for 10 to 12 years. People have only been consistently vaping, for, I think the longest vapor I had was like, 5 years. Some studies have some that have vaped for 8 years. So again, like sometimes you need a long time to see these signals. And so we have done like a lot of mouse models. So I'm going to share a little bit about that. But in terms of like what are the factors that to consider for how vapes affect health? So we talked a little bit about the e-device generation, and that one really comes down to like temperature and then also the amount of nicotine. Flavors we mentioned. Some flavors have been proven to be very pro-inflammatory. Some have the opposite effect. The nicotine concentration. So 3 milligrams per mil is very different from 60 milligrams per mil, which is what most of our current vapors are using. Patterns of use, like whether they're combining it with all these other inhalants. And then, yeah, that's the whole bottom panel. So if you want to game and vape at the same time, so this one comes loaded with 3 different games, Jet Fighter, a Pac-Man inspired challenge, and Tetris. So you can game and vape. If you wanted to look like a smartwatch, this is the one for you. So designed to look like an Apple Watch, you just pop it out and vape and put it back on. Or if you're like me and 99% of the time your phone is in your hand, like you don't want to have to use your other hand for your vape, so you can combine it with your phone. So what diseases do we know that e-cigarettes are going to cause? So the number one is the one that is specific for vaping, E-Valley, the epidemic that happened in 2019. It's the only one to date that is specific for vaping. It was a disease of the young, many teenage and young adults, predominantly males, which we think is driven because they were the population using THC vapes. So at the time of the epidemic, 82% of the vapors who had E-Valley, it was due to vaping of THC, but there was this signal underlying of the 16 to 18% that did not vape any form of cannabis, and they were vapors of nicotine only. And it's been nice to see that that was a true signal, because since that time, since that massive epidemic, now when we see E-Valley, it's like half of the patients are vapors of nicotine and half are vapors of THC. So we think that E-Valley was in existence, ever since vapes hit the market. And I remember cases, from before the epidemic, so that there are things inside the vapor that will cause lung injury. But for the epidemic, it was due to vitamin E acetate, this massive molecule, which is fine to put on your skin. It's fine to actually eat it. Just don't inhale it because it's highly toxic to the lungs. And at the time, I was asked to do an editorial, which was really fun, from JCI. And they were like, just tell us what you think is happening. And I was like, really? Like, no data? Like, you just want me to expound on like what I think is happening? And they're like, yes. I was like, awesome. And so this is still what I think is happening. So on the left is that when you inhale these chemicals, they, hit all of your epithelial cells. They quickly go through your endothelial cells and hit your bloodstream. They're hitting all of our alveolar macrophages and respiratory immune cells, and they're altering them. They're causing immunomodulation. And so that then, if you go to the right, if you have another challenge, like you have exposure to air pollution or a viral infection or aspiration, your lungs are going to respond differently than they would have without that aerosol. This is the hoodie vape, backpack vape. And as I mentioned, like, they hit the airway cells. So what does that mean? Like in terms of like what's happening in the lungs? The biggest signals are really coming from the epithelial cell compartment. So in this study, we had 18 to 30-year-old vapors come in, and we did nasal brushings for the epithelial cells in the upper left-hand corner. We also did induced sputum in the lower left. We did PAX gene, which is a surrogate for neutrophils in your blood. And then in the upper right were the peripheral blood mononuclear cells, so a macrophage signal. And you'll see that like the nasal brush has a lot more red dots. And so the red dots are the significant gene expression changes. And so there's a huge signal in the nose compared to the other 3 compartments. And so, this is where we're sort of starting to see parallel signals across different sites. So Denver has a cohort of young vapors, and then even an older group in Boston. And so we're tracking down those signals, but I think that the nasal area is concerning because, that's where our viruses and our bacteria, like they enter there for the most part, and then they sort of go down further. And so our immune response is going to be fundamentally different in the nose. And when we've drilled down on this a little bit, there was one main gene that was downregulated in our vapors, the FOXRED2. And that one actually inhibits proliferation, invasion, and migration and promotes apoptosis. So it's a powerful cancer gene. So it's usually suppressed, and that will allow for proliferation and cancer development. On the other side, we have this cluster of genes that were upregulated, including the Ly6G6C, and that also has a role and is often upregulated in tumor progression. So we're seeing these sort of bigger cancer signals as well in the epithelium. Beyond that, on the left is our endothelial cells, sort of a compilation of data. We've seen increased oxidative stress, DNA damage, and dysregulation of metabolism. And then on the right, across different epithelial cells in the respiratory tract, changes to the cells, blunted immune responses, increased mucus. And I showed like in the sputum, there weren't that many changes, but these were the significant ones. And it was a cluster, and we're teasing out what that means, but there are some metabolic signals there. We'll see. And then in the circulation, we did a study in 2017, and then now we've done and so that was second and third generation users. And then now we have the data on our fourth generation users. And what we see is if you separate people out, the inhalant users, by e-cigarettes with nicotine in red, vapors of THC in blue, and then the purple is the combination of the both, you see some subtle changes, some differences between those groups. And in particular, the IL-10 being like elevated in the THC vapors is ominous for like activation of this sort of anti-inflammatory pathway. Like, why would you have that activated? And often our vapors of THC, and I don't know who else has noticed this, but they tend to have more symptoms, like more respiratory symptoms, suggesting that they have more sort of inflammation occurring. And Alexia Perryman did this work. So overall, when we've looked sort of epidemiologically and through like surveys, any use of e-cigarettes has been associated with a 1.32 greater odds of having a respiratory illness. And these two studies were both in 2024. And then on the Song, who published in Scientific Reports, the e-cigarette users had increased risk of reporting respiratory symptoms and COPD, which there's some debate about that. And finally, the dual users of vapes and smokes had the highest elevations in respiratory symptoms and COPD. So 41% of dual users were reporting symptoms. And so that's sort of like the other main takeaway, is that if you're going to do anything, like pick one and go with it. The biggest signals we've seen in the last few years is people who vape and smoke like have like the biggest adverse signals across all of the studies that I've seen. This one syncs with your phone, so like an Apple Watch. So you can be carrying it, doing like everything that you would normally do on your Apple Watch. And this one is odd because it's a photo screen. So if you want to have your photos displayed and like scroll through them on your vape. Oh. So I get asked this a lot. I don't know if there's a show of hands, like who thinks vapes are going to cause cancer? Nice, you guys are so smart. And so the first study that we published, actually, like ages and ages ago, was that the aerosols cause DNA damage. So we had shown like that they cause double-stranded DNA breaks. Multiple other groups have found the same thing, and they also suppress tumor DNA repair pathways. So it's sort of like a double hit going on. This is one of our e-cigarette exposure systems. So each of those little chambers is for a different e-cigarette vape. So one of them's for Eve with nicotine, one's for Eve without nicotine, one's for tobacco flavor. So we have all of these things. And one of the studies that we did, we actually looked at the gut because, the gut, the microbiome, like inflammation in the gut, we know that's tied to overall body health. And what we found was that e-cigarette with nicotine caused the same amount of inflammation as mice that inhaled combustible tobacco smoke, is the third one over. And then the far one on the right, it was half and half. So instead of 2 hours of vape or 2 hours of cigarettes, it was 1 hour of each. And that had the largest signal for the most inflammation. And then in the lower right-hand panel, we also saw elevations and markers of proliferation. And I mention this because there's multiple things that drive tumorigenesis. So on the left-hand upper corner in the blue, DNA damage. We know that's happening. In the yellow, we have evidence of inflammation in the endothelial compartment and in the epithelial compartment and immune cell function. In the red, we've actually seen epithelial breakdown in a dish. We grow the epithelial cells at the air-liquid interface, we expose them, and they become leaky. And they actually have decreased zona occludens. If you think back to your cellular days, like that breaks down, and so more stuff gets through. And if you think about that in the GI tract, more things get through that causes systemic inflammation and higher infection risk. We're still working on the green circle there, so we're not exactly sure what's happening on the immunomodulation front, but more to come there. But when we take mice that naturally, they're KRAS mutant mice, but they all develop lung cancer. And if we take those mice and we expose them to e-cigarette with nicotine in the middle, and then e-cigarette without nicotine on the right, you see higher incidence of these adenomas that then go on to become adenocarcinomas. So that is sort of like just a core mouse experiment to confirm. And there's been 2 other mouse studies to sort of show very similar things. We did that in the GI tract as well with mice that developed colon cancers and saw something similar. But this study came out in August of last year, and it was the first piece of like real human data that was convincing. And so this group found that if an older adult who vapes and smokes, their odds ratio for developing lung cancer was 21, versus if they smoked alone, it was 6. So we all know that smoking leads to lung cancer, so that's an odds ratio of 6, that makes sense. But the odds ratio of 21 if you use both together. So what we think is happening is that the sort of tumorigenic, carcinogenic pathways happening from combustible smoke are not the same as the ones that the vapes are causing, and that you're getting this sort of additive synergistic effect when you have all of it put together. The asthma story has been a little bit more confusing, and I'm going to show you some data why. So on the human side of things, there's been like pretty powerful pro-asthma signals. So in the upper left-hand corner, a 252% increase risk of asthma onset at an earlier age for adults. In the middle one, the e-cigarette use was strongly associated with symptoms of asthma and chronic bronchitis. And then in the bottom one, the prevalence of asthma was higher in our dual users of the combustibles and e-cigarettes versus cigarette smokers, non-smokers. So 22% for the dual users, 21% for e-cigarette vapors, 14% of cigarette smokers. So there's been signals that vaping might drive asthma inflammation or drive symptoms similar to asthma. I know you guys don't need to worry too much about COPD, but your patients down the line, if they start vaping now, they'll probably be smoking. Some mouse models demonstrate emphysema. So when we expose mice for 6 months, that's sort of the equivalent of 60 years. But it's genetic, we think, because some strains develop emphysema and some do not. And also it's probably the type of vape too. So some chemicals in a vape drive emphysema type inflammation, others don't. So what have we seen? So with the weird asthma signals in the human populations, we wanted to sort of drill down on that in our mice. So we exposed mice to regular air, and then we induced asthma, which is what the OVA means. And so the bright blue turquoise are the regular asthma mice. And then right next to them are mice that inhaled all the vehicles, but no nicotine, no flavors. And they had like increased inflammation when they were challenged with asthma. But then our nicotine vapes really didn't change anything. And then our tobacco flavored vapes actually sort of decreased the inflammation. And on the far right, that's sort of what you see again, is that the eosinophils is our most powerful sort of signal in our mouse models of asthma. And all three vaped groups had fewer eosinophils coming into the lungs. So we're like, great. So we're going to be suggesting vaping to treat asthma. Like this is not going to go over well. So we've been like doing a deep dive on the immune front to really try and figure out like, what really is happening. And again, like mouse models aren't perfect, but they can help you drill down on very specific cells and different chemicals. So in the upper panels are leukocytes, so total leukocytes. And so the far right is our tobacco flavored e-cigarette, which again had lower numbers, the eosinophils you saw, and then the inflammatory monocytes had an interesting pattern too. And then on the bottom panel, just, a few more important asthma cells. And Samvel Gaboyan is one of our master's students. That's him bronching at ATS. And you see the huge grin on his face. Like he was so excited to be able to use a bronch. So when we looked a little bit closer at the eosinophils in the lungs, so you remember that they were in lower numbers. So in the BAL and in the lungs, they had very different signals. So in the lungs, the eosinophils actually had elevated activation markers in the nicotine group. And so we want to sort of follow that up to see is that part of what's going on, is that they're really altered in their responses. And then the other thing was that there was actually elevations in these alarmins. So these are sort of the signals, something bad is going on, there's inflammation going on. And so this can be a precursor to the recruitment of cells. So we're going to be adding other time points to see if, because there's elevations in these at the time that we did the harvest, what if we did a more chronic model? Like, what is that going to mean? Like, are they going to catch up to the regular asthmas? Are they going to go beyond? We're not sure. So in the world of mouse asthma, we're still a little bit confused about what's going on. And if you look just at our T2 cytokines, we harvested the mediastinal lymph nodes and challenged them in a dish, and you see that they had a blunted response. So our purple, green, and brown are all of the e-cigarette groups, and like none of them had a normal response with IL-4, IL-5, and IL-13. And while this still seems like, well, this sounds great for T2 asthma, like if this suppresses like that kind of inflammation, like what's wrong with that? But it suggests, again, like there is immunomodulation going on. Like the cells are not responding the way that they should. And that suggests usually that they have an elevated T1 response, which can take you to a whole different set of problems. So we're sort of following these up with other sort of challenges to see if these mice are at risk for other diseases. So if you were going to take away 5 things, I hope I've convinced you of the first one, that e-cigarettes alter the immune system across the body, and that's going to lead to lung and systemic diseases. Second one, they're going to cause cancer. Third one, I didn't show a lot of data, but like we've shown altered function in the kidneys, fibrosis in the liver, fibrosis in the heart. And a lot of cardiovascular signals are out there for humans. So in terms of raising diastolic blood pressure, altering heart rate variability. So these big markers for downstream cardiovascular effects. Multi-inhalant use is worse than anything alone. And then finally, if somebody's inhaling one thing, odds are they're inhaling other things. I feel like we always need to be thinking about opportunities and policy. So one thing that we've talked a lot about is whether we should put different limits on nicotine. So in the UK, they aren't allowed to put more than 20 milligrams per mil in their e-liquids. So companies have different products for the UK. And that's actually might be why they never had the big adolescent teenage epidemic of vaping that we had here. But our teenagers were vaping 60 milligrams per mil, not 20. And if you talk to them about the first time that they vaped, They said it's like shotgunning a beer. And I'm like, you're 18. Like, why are you shotgunning a beer? But it's just like a big hit and like a very high high, and then nothing can replace it. Another opportunity is banning flavors that target children, women, people of color, banning sales near schools, and limiting advertising. So these are some of the appealing flavors: blueberry muffin, cookies and cream, lemon sugar cookie, strawberry ice cream, churros. And then this is like advertising that is, like, to me, very offensive. And then other important messages is that the base ingredients are not safe. Yes, propylene glycol, like, has been used in stage productions for years. You can actually eat it. It's still fine, but the lungs, it does alter the lungs. Nicotine is extremely addicted. And again, if you use one inhalant, that actually predisposes you to picking up other inhalants, especially in that critical years before 25, when your brain is still developing. So ending on the one most likely to be seen maybe in the hospital. So these are vape pens that literally look like pens. So I want to thank all of my collaborators at UCSD and beyond, who really did the majority of this work, and then my lab crew, who are amazing and come up with all kinds of great questions that we have fun pursuing. And thank you to the funding organizers. Thank you.